Autism Spectrum Disorder, or ASD, by me. How does a person contract this disorder? To be honest, scientists don't know the cause of autism yet, but we do have a couple of theories. One could be genes. Most people with autism have some mutations in their genes, but linking them to the severity of their autism and whether or not they have it is still an iffy thing. Genes and environment. People with certain gene mutations may be susceptible to chemicals in an outside environment that someone else would not be. But someone with these same experiences may not have the same reaction to these same chemicals. Other biological causes. Scientists may also say that it is other random biological factors like brain connection, incorrect growth of the brain, metabolism, or even the body's immune system. What are the early symptoms or warning signs of this disorder? As the disorder progresses, what can it do to a person's health? Some early warning signs of autism include not responding to their name after 12 months, not pointing with interest by 14 months, does not play pretend by 18 months, avoids eye contact, and wants to be alone and play alone. They can't understand or explain feelings. They have delayed speech, repeat words or phrases over and over again. They can also get upset over minor changes in their schedule. They could flap their hands or rock back and forth. This is called stimming. As a child goes through puberty, their behavior will get worse before they learn how to handle it again. Autism itself doesn't do anything to a person's body or health, but there are some health problems that accompany it sometimes. They can have gastrointestinal problems, epilepsy, feeding issues, disrupted sleep, attention deficit or hyperactivity disorder, anxiety, depression, obsessive-compulsive disorder, schizophrenia, and even sometimes bipolar disorder. How do doctors today diagnose this disorder? Doctors diagnose autism by a battery of tests, and it's really just excluding everything else, because there's nothing physically wrong with anyone with autism. People with autism are diagnosed by being observed and interacted with by professionals. They can look for absence of eye contact, trouble communicating, not understanding emotions, and how they play with others. Is this disorder contagious? Absolutely not. No. Why would you ask that? What's wrong with you? If someone has this disorder, is there a cure? There is no cure for autism, but there are some treatments that can help a little. Someone with autism can go through behavior management therapy, cognitive behavior therapy, and early interventions in educational and school-based therapies can also help. Joint attention therapy, medication treatment, nutritional therapy, occupational therapy, parent meditation skills and therapy, physical therapy, social skills training, speech and language therapy can all be part of their disorder, autism. None of these actually treat autism itself, but the problems surrounding it, like speech problems, stress, and social abilities. Are there any activities a person would have to avoid if they had this disorder? No, not really. There are no set activities someone should avoid if they have this disorder, because it's on a spectrum of severity and different for every person. It really depends on the child. But some activities, including driving, if they can't handle the stress of everyone else breaking the rules of the road, or if they can't focus on one thing for a very long time. Others could be riding a bike if they are unable to balance very well. Another could be living on their own. A lot of people with autism are unable to live by themselves because what they need to keep themselves clean and healthy isn't always at the front of their priority list. How many worldwide deaths per year is autism responsible for? None that are necessarily directly related to the disease itself. But sometimes a person with autism can do something that they don't know will necessarily hurt them, just like any other human. Also, because some people with autism have a way higher pain tolerance, they can hurt themselves without even realizing it. Drowning is a leading cause of death for kids with autism, but it also accounts for 90% of deaths of kids that don't have autism. So I guess that leaves you to decide if it's more of being a kid or having autism that affects that. After childhood, the leading cause of death are epilepsy, suicide, and cancer, and heart problems. Early death is about 2.5% higher in people with autism than the rest of the population. So, not that big of a difference. What year was autism discovered? In 1908, some guy that's name is hard to pronounce coined the term autism as a way to describe his less social schizophrenic patients. And in 1940 is when researchers in the United States actually began to use the term autism. In 1943, a psychiatrist, Leo Kanner, believed certain traits describe autism and that it shouldn't be part of schizophrenia anymore. In 1944, Hans Asperger, a German doctor, described a milder form of autism as Asperger's. In 1965, establishment of the Autism Society of America happened. In 1967, Bruno Blechowicz claimed the disorder was due to the coldness of their mothers. This later turned out to be not true because, In 1980, autism was classified as a developmental disorder in the long gene name. In 1994, Asperger syndrome added to the long gene name as a progressive developmental disorder. In 2000s, due to public concern, vaccine makers removed thermomyolysis long word from vaccines because Karens thought it caused autism. It does not. Very stupid survey, whatever. In 2001, blah 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 estimates that autism affects 1 in 250 children. In 2004, the Institute of Medicine finds no evidence linking that long medical word and autism together in vaccines, yet people still believe it and refuse to get their children vaccinated. So, screw them. And in 2007, the CDC reports that autism now affects 1 in every 150 children, not 250 in 2001. The thing with that is it's not necessarily that more kids are getting autism. It's the fact that people are starting to recognize the symptoms of autism and going to the doctor and getting their child diagnosed with autism or Asperger's. The amount of people with autism has not increased like all of these stats will have you believe. Find 3 interesting facts about your disorder. Okay, I found 4. I'm better than you. About 1% of the world's population has some form of autism, whether it being really low on the spectrum or really high on the spectrum. Another one is that men are way more likely to be diagnosed with autism for the fact that men have it 3-1 to women. Another one is autism diagnoses worldwide increase on average about 15% every 2 years. Again, it's not increasing, just more people are being diagnosed. And a sad thing is, autism is often diagnosed sooner and more often in white families. This is not because white people are more likely to have autism, it's just because white people are more caring and paranoid about it. And they have normally more access to healthcare and those professionals that can diagnose someone professionally with autism.